Yeah, this is a very interesting age of AI. And today we will discuss some cutting-edge AI technologies. And let's try also pick what's the direction for the AI to go in the future, so we can prepare for it. First, I want to talk about one example that the AI technology helped just one patient. The New England Journal of Medicine and the New York Times all published the stories this August. A man with ALS lost the capability of speaking. A group of researchers in UC Davis planted the AI device into his cortex. Then the device can collect the neural signals from the cortex directly and predict the sentence the patient try to speak, and speak it with his own voice. And after a few sessions of training, the patient can communicate with families directly, and you can imagine the families were overjoyed. And after a couple months of training, the patient can express very sophisticated thoughts efficiently and at a very high accuracy. So this is what's happening behind the scene. The first part is the voice, the patient try to speak. The second part is the neural signals, the electrodes collected from the cortex. Then this part, very interestingly, the neural network cannot predict the words and the sentence directly, but it connects to the phonics. So basically, the element of the word. What do you try to say? Then they use an open source language model to predict the sentence and the word and sentence from the phonics. So my question to you is, it seems this research can help us to understand a lot about this neural functionality in terms of speech. Is it possible one day we can understand every neuron in our brain, how they are connected, what is the function? Do you think it's possible? It sounds like science fiction, right? Maybe it is. But the researchers from many Princeton University reached the first wiring diagram of complete brain. They identified every one of 140 neurons, more than 50 million synapses, the connections, including 8,400 cell types belonging to 78 brain regions. They even set up a model how this brain works. Of course, the human brains are much more complicated than this. But the same AI technologies helped to segment and annotate the fry brain and also help us to analyze the human brain. And you may know that kind of AI technology, not inspiration for our neurons. So when we begin to understand more about our brain, how our brain works, maybe it will give more inspiration to the AI network. And then we can develop even more advanced AI to help us to understand our brain better. So this can be a closed loop. And you can start. Thank you. Okay, that's maybe still a little like a science fiction. Let's go back to the reality. Today we talk a lot about the cancer detection. And this paper published last month asked a very good question. The AI-based image analysis holds promise, right? We often saw many beautiful papers, but 99% of the study don't reach clinical use, right? We don't see it. And what's the reason? And the reason can include the data set is small, and it's not general enough. The models built from one device, even with just one brand, does not work well for another brand. And the most important, there's not enough clinical validation. I think AI model can really work if it can involve lots of physicians, like everyone here. Otherwise, it may just stay on the paper. And this study tried to solve the problem, and it included 6 institutions from Europe and Japan. And it included 5 scanners and 1,500 patients. But we know this is not enough. And some hardworking doctors here can see 1,500 patients a month, right? So the whole study only have 1,500 patients, probably not enough. So next study did a bad job. This is from the Harvard University. So they tried to come up a pathology foundation model for cancer diagnosis and prognosis prediction. So this study included all the 19 anatomical sites, and it has participation from 24 hospitals, including 19,000 whole slide image, which can be divided into the 15 million pathologist types. So I think this is a trend. For AI model to really work, it need to involve lots of physicians, lots of clinical science. And everyone need to work together to solve the problem, to make the model useful. This is a review of FDA-approved AI-enabled medical device. And you see it is coming. Of course, radiology is still the majority, but other specialties also begin to have the AI-enabled device. So overall, more and more AI-enabled device will come to market, and we need to be ready for it. Okay, now let's switch gear a little bit to the drug discovery. We know protein play an important role in life, and it's very hard. It used to be very hard to predict the 3D structure of protein. But it's not anymore. 2021, DeepMind released AlphaFold 2, which can predict the 3D structure of protein near experimental accuracy. And Google uploaded the 3D structure for all the proteins that predict. You know how many? 200 million. And you know, it used to take a PhD student 6 months or more to detect, to figure out the 3D structure of one protein. And Google did 200 million. And also the structure now also imported to other portals, which combine the protein structure and the function for the researchers to use. And one application of course, it has many applications. One application is to figure out the clinical significance of DNA mutation. And it also used to take a long time to figure out whether a DNA mutation is benign or harmful. Now we just did all the possible human single amino acid substitution, and 89% of them can be classified as either likely benign or harmful. So this is the character of AI. Once it's figure out how to do a thing, it can do it very efficiently. And no human can compete with that. And the AI does not stop. In this May, DeepMind released AlphaFold3, which can predict the structure followed by molecular interaction. So, say for this example, it can predict the structure when a protein is interacting with the RNA and islets. And this can be very useful for the scientists to understand the fundamental process in the cells, right? So it can be very useful for the drug discovery. And you might even did further. So last month they released the AlphaFold proteome, which can just design the protein binders for us. So in the paper, they listed these 7 target proteins which can cause cancer, COVID, HIV, chronic pain, right, and others, very serious disease. And the first chart here shows that the successful rate within this method is much higher than the best previous design method combined. Especially for this target protein, this is the first time human ever developed a binding protein for it. And just with this AI tool. And the bottom chart shows the binding affinity, basically the minimum concentration needed to bind with the target protein. So the lower is better, and the binder designed with this model are much better. So they basically are much more efficient. These are 4 spike protein of COVID, different COVID variants. First, the researchers demonstrated that they designed 4 different binding proteins, all can bind with the target effectively. Also, the experimental structure is almost exactly as what they predict. And the more important, all 4 binders successfully neutralize the 4 COVID variants. So functionally, it works. And this study, they just released last month. I don't know what more they will do on the road. Okay. As Dr. John mentioned this morning, the whole society began to pay attention to AI because of ChatGPT. Because such language models is the first time for everyone to talk with AI, and it's very powerful. And there are 3 kind of flavors in biological language models. The first one, like ChatGPT, is general, but we trained it with all the medical textbooks, Wikipedia pages, and medical journal articles. So it has a good understanding of the medical knowledge. Metapalm 2 is an example of second flavor. It went through the biomedical fine-tuning with additional medical data to improve its performance. The last one, I'm not sure it's language model because it's not trained with human language. It's trained with biological data or biological language. For example, for the single cell GPT, it's trained with single cell RNA sequencing. The researcher believes the gene expression is like our language. It can go through the same kind of training as we train the AI models. And underlying, it seems our language, the structure of our language is universal. It's not just for for us to understand our own thoughts. It's the key to understand the whole world. And we will discuss more about all these models. Last year, in May, Google released the Metapalm 2, which can answer the US MLE questions very well, achieve the human level. In addition, it can answer open questions very well. The physician referees prefer the answers from AI model than the physicians in most categories. Then, 6 months later, Microsoft released a paper claiming that GPT-4, even as genetic, can answer medical questions even better, just with some prompt engineering. And this January, they begin to train and release articles. They started training the AI model to have dialogue with patients. I think probably later, the session after this, we'll talk more about this. So here, I want to point out, human communication is very complicated, right? Take one example. If you are standing here and close to a window, and your friend say, "It's a bit hot here." Are your friend just talking about the temperature, or they are thinking something more? Well, probably they want you to open the window. I know this can be hard, even for human beings sometimes, especially for the husband. Right? If you want something, just tell me. Don't just give me hint. I cannot get it. But can AI model got it? The answer is yes. And besides this is called hinting, but it can get all kind of subtlety in language, like including irony, right? And this morning we talk about the psychiatry of human being. The author believes this is a psychiatry of machine. So people begin to study this. But ironically, they published this at the Nature Human Behavior about the machinery psychiatry. So they try to improve the AI models to understand our language better. Now let's talk about the language of biology. Before we go in there, I would like to go back to the time, how the large language models get started. in 2017, Google published a paper called "Attention is All You Need." In this paper, they pointed out, in order to understand the word of meaning, you need to understand. Basically, you need to get attention from the context. For example, in this sentence, the Python got heavy attention from the word bit. So the AI model now, this is referring to a snake. In next sentence, the Python got heavy weight from programming. So it knows it is a programming language, not a snake. So by doing this, the AI model can understand each word very, very well. And then they understand the whole sentence well, the whole paragraph well, the whole article well. So this get everything started. Next year, OpenAI released their first version of GPT. They're using the transformer structure introduced by Google. Now, some researchers believe this kind of attention is useful for biology. For example, they believe, the expression of one gene is not that meaningful if you don't understand at that moment the expression of other genes. What happened now and what happened before. So everything is related. You need to know all the gene expression at that moment to know what's the status and can predict the future. So maybe there's some truth here. We will see. Okay, we just talked about the large language model in the past because OpenAI just released another model, not ChatGPT 5, but O1 last month, because they think it's revolutionary. For example, if we ask the O1 to make a diagnosis based on the following included phenotypes and the excluded phenotypes, the current model will just give you answer after a few seconds. But O1 will do the reasoning first with chain of thought. Here I highlight some of its thought. This is not answer. This is before it answer your question. So firstly, figure out what is task. Then it think, oh, I need to think of a genetic syndrome that matches these features. Then do some reasoning. Then have the first guess. Then found the contradiction. Well, have the same guess. Found the contradiction again. Then have the third guess. And really validated the guess. And decide this is the answer. Then it will start to give you answer. Do you think this really think like a human being? And this is not the most sophisticated chain of thought. On the website, it can be much longer than this when it tries to solve very complicated questions. So this model can get the International Math Olympic medal. So it's so sophisticated. Now, let's go back to our medical scenario, right? So how we can use all these models in our clinic? First, let's talk about a virtual one developed by Tsinghua University this May, based on an article published by Stanford University last year. So here, they designed a virtual hospital as virtual patients and virtual doctors. So virtual patients may come to the doctors, and the doctors will assess the situation, suggest some medical examinations. So patient will get the medical examinations, then doctor will get the results and give a diagnosis and recommend the treatment plan. And later, of course, doctor will also get the feedback about the treatment plan. And also very interesting, at the spare time, when the aging doctor is not busy, they will also read the medical books. And you think that this is just virtual, but they found after such kind of training, they started with GPT-5 and GPT-4. These agents, the doctor agents, can answer the medical questions much better than before. It seems they can learn from this kind of experience. I know ACAP is doing a great job about the mock interview, right? And at least I think this can be useful for the medical training, right? Also, here, you can have all kinds of doctors here, virtual doctors here. Can we have PCP or the specialists, all kinds of specialists here. Each doctor can, good on different things. So at least I think it's good for training. And for the real setup, clinical setup, clinical workflow, last year, the competitors, these competitors, Google and Microsoft, DeepMind, OpenAI, strategically worked together with NYU and Stop TV, did a study together. Because they found when they do for screening for breast cancer or TB, for some cases, AI models is better. For some cases, the physicians are better. So they designed a model to decide which case they should send to the AI and which case they should defer to the physician. When they combine them together, they can reduce the false positive by 25% and reduce the clinical workload by 2/3. Of course, if you own a clinic, you probably will like it, right? And you can have bad treatment performance and can either see more patients or the physician can have your life back. And in reality, of course, we will not just let AI do the diagnosis, right? And it will go back to the senior doctors for the review. Yeah, but you get an idea. Okay, in the end, I put 2 quotes here. The first from Jeffrey Hinton, who just won the Nobel Physics Prize for his contribution to start the age of deep learning. And you see, today the AI model is so powerful because we figure out how to generate an internal representation to reflect our own world, right? But that's okay. And the second one, probably you've heard many times, AI wouldn't replace humans, but humans with AI will replace humans without AI. Today, I want to treat it a little bit. I would say the AI models work with physicians will have a real place in our society. Thank you very much.
Great talk, very inspiring. I'm sure it'll generate a lot of questions. So,
Did he say what characteristics favor the one that's AI generated, like
Yes.
automatic accounting better? Oh, so there's a difference, right? They say there's some protocol that's AI enhanced better versus less. What are the characteristics which makes AI generated more efficacious? Now on the bottom there, they said they divided up, right? Certain ones work with AI better, and certain ones you don't. Did they find out which ones, like why the characteristics? Are they more like objective data versus subjective data?
Yeah. Very, very good question. Thank you. Unfortunately, they did not reveal that. But this is one thing, right? Let's go back to the problem of AI I mentioned in one paper. Here, right? We need everything to be explained. But one problem with the AI, many things cannot be explained. But in order for the AI model to really be used, people can trust it, they need to give us explanation. So that's the difference between, I'm a data scientist, I'm not a medical doctor, and for us, for engineers, as long as it works, it's great. We don't care so much. We care about it mainly from our curiosity. We know. But for our boss, doesn't matter. As long as it works, right? Company can make money. Let's go to market. But fundamentally, we really need to know more about what's happening inside. And if this paper try to do more about that, for each segment, what's the meaning of it? So we begin to see more, but we should see. But I hope the whole AI community can work hard on that side. Thank you very much.
any other questions? We have time, so I have a couple of questions. Number one is, I think your quote and quotation of the two famous and people call him the father of the AI is very fundamental in a way, right? And so far, the AI algorithm we perfected have to have underlying intrinsic algorithm to guide their selection, whatever the algorithm is designed by humans.
Yeah.
The logic for the different steps that you mentioned ways. But we are the ones defining the logic so far, right? So will the AI software we develop over time will be able to self-define logic and self-evolve to the point that they can have self-awareness and have consciousness.
Yeah.
So that if that's the case, then we're creating another species in the planet Earth, right? That's potentially much more powerful, faster, and stronger.
Jeffrey Hinton left Google just because that the godfather of AI saw the danger of AI. And at Google, he couldn't speak freely because Google need to say, hey, we have AI technology, we develop AI technology. But he wants to give the warning to the whole society about it. You are totally right at this moment. Let me go back to the architecture of here. These kind of architectures are defined by human beings. But if one day AI can design their own architecture, their own algorithm, write their own code, basically they can generate their own next version where humans lose control. The danger is there. And of course, there are arguments, but for this, I'm aligned with Jeffrey Hinton. We need to be careful. Even I'm, using AI all the time. I sometimes, develop neural models, but I really hope the whole process can be slowed down.
So how do you put in the safeguards? What are the safeguards you can put in to say you can't, like nuclear weapons? The Pandora box is opened. Once you have it, how do you stop it? Right? So, yeah, we have these, gigantic companies, dominating the world, competing with each other. But whoever has the power to develop the most sophisticated AI will rule the world. How can you stop someone from doing that? Or state players, or say terrorists? How can we are in the stage already no return, and then that's the inevitable fate in a way if with the AI is developing and evolving and there's competition just like nuclear arms.
You are totally right. This is very hard because of competition, basically. One of the companies, the big companies are doing their own safeguard. Right? They tell us when GPT-4 and the GPT-01 released, they invite some third party to do the testing. But that's the artifact. That's after they released the model. They told us how they did the test.
Exactly. So human nature, I think, allowing for control, allowing for complete, will actually doom us. I think that's my view. A little pessimistic, but I think that's something that's in the long term.
Yeah.
And maybe that's why Musk saw this coming. They're sending us to Mars. Great! Wow.
I'm just curious. To me, AI is a tool. It's like a hammer. It's a tool.
Yes.
So it depends on the person who uses it. He has good intentions. You believe human nature is good. You use the hammer for doing good things. But if you believe that it can be corrupt or something illegal, they can use the hammer to do violent things, right? So I think it depends on the user. I think the future is that can you safeguard some tyrant or some crazy maniac to use the tool to dominate the world? I mean, to me, I don't know how to control that. You know what I'm saying? So
I think that's a good point. Like, if you're truly a tool that actually.
how do you safeguard the tool? But you still have someone who uses it for something for evil purpose.
No. So the question fundamentally is different than what the point is that if the tool becomes self-automated, it has intelligence.
How do they know what's good versus bad? They don't really. If they say like peace on earth is kill everybody because we're all unpredictable, emotional, and whatever, that they kill everybody on earth, right? You think that's logical? That's logical, right?
Right.
So
So that's the fundamental question: to what degree the AI can evolve to that it can itself develop algorithm or judgment. What is right, but what is right for the AI may not be what is right for the humans. So that's the fundamental question. It's not who get hold of this and control the AI. It's the AI itself. What should happen, right? Their logic may be different than the humans than what they think is the right thing to do for that species, right? Have you anybody seen the movie iRobot?
I choose this example. Hello. Hello. Oh, okay. So in fact, I choose this example on purpose because I really don't care about how AI is applied somewhere else. I really care if AI can help human beings, right? So even in this case, it only helped one patient. It was it. So I hope the whole society is a resource can focus on this beneficial research, right? So let's figure out how AI can really help healthcare, really can understand our own life better, what's going on in our body. There are many unknowns, and it's really, sometimes it's frustrated, right? We thought, we grow up with the genomics project. We thought, oh, once we figure it out, it is done. Healthcare problem can be solved, but it's not. It's sophisticated. So even with technology like AI, it will take a long time, in my mind, to solve the problem. So I hope the society can really realize it. Don't spend it, to create fake news, create weapons, but really spend it on healthcare. And I hope, all the physicians here will involve in the process as well.
Thank you, Dr. Lee. That's very, very good. I think this, our kind, from our bottom of our heart, that's what we all hope for. But hopefully that's true. Anyone else? Thanks. All right, it's now my pleasure to introduce our next speaker, Dr. Chen, Paul Chen, who is currently the Director of Division of Surgical